I'm Dr. Linda Gromko, and this is Transgender Medicine Made Simple. Today we're looking at the topic, testosterone can increase your red blood cell count. On testosterone, your red blood cell count will increase, and so will your hemoglobin and likely your hematocrit. We'll look briefly at the following. First of all, we'll define some terminology. What do you know about this rise in red cell count, hemoglobin, and hematocrit? What can happen if the red cell count is too high, and what can we do to correct this? So let's take a look at blood composition. If you draw a blood sample from a patient and spin it down in a centrifuge, the blood separates out into three layers. There's the plasma layer, here shown in the picture as a yellow layer. There's the white cell layer, this is also called the Buffy coat, and there's the red cell layer here. Now, the red cell layer, when you look at it as the percentage of the total blood, this is called the hematocrit. So the hematocrit, abbreviated HCT, is the percentage of blood that is red cell. More terminology and abbreviations. So we have RBCs, that's the total number of red cells. HB, or hemoglobin, is the molecule in the red cells that carries oxygen. It is contained within the red cell. Then we have the HCT, or hematocrit, which is the percentage of the blood that consists of red cells. So as an example, if you have 40% of your blood consisting of red cells, your hematocrit, or HCT, is 40 or 40%, and that's normal. If you have 20% of your blood consisting of red cells, your hematocrit would be 20, and that's a low hematocrit. If 50% of your blood consists of red cells, your hematocrit would be 50. So more background. Our blood cells, which consist of the red cells, white cells, and platelets, are produced deep within our bones in the bone marrow. Our kidneys produce a hormone called erythropoietin that stimulates the production of these red cells. People who are assigned male at birth will have higher red cell counts than do assigned females at birth to begin with. Now, what is the condition polycythemia? So let's take a look at the word. This consists of three Latin roots. We have poly, meaning many, cyte, meaning cell, and hemia, which means a condition of the blood. So polycythemia means too many cells, but usually refers to too many red cells. A little more about polycythemia. There's primary polycythemia. This is also called polycythemia vera, and it is regarded as a type of blood cancer, and it's not testosterone related at all. And then we have secondary polycythemia. Too many red cells that come because we are living at a high altitude. We have heart or lung disease that lowers the blood oxygen, so we make more red cells to compensate. Sometimes we'll see this in sleep apnea, and certain medications, particularly testosterone, can create a secondary polycythemia or increase in red blood cells. So how do we know if the red cell count is higher? In a blood count, we can measure the red cells, the white cells, the hemoglobin, and the hematocrit. As we said, the hematocrit is the percentage of the total blood that consists of red cells. In secondary polycythemia, the red cells, hemoglobin, and hematocrit will all increase. When the red cell count or hematocrit gets too high, the blood becomes more viscous or thicker, and it's thought to lead to blood clots forming in small blood vessels, and it can even lead to stroke or heart attack. So what can you do if the red cells and hematocrit are too high? You can drink more water to increase the plasma portion of the blood. You can decrease a person's testosterone dosing, or you can do phlebotomy or removal of blood. There are two methods for phlebotomy. One is blood donation. The other is therapeutic phlebotomy by prescription, which is done to treat a person who has excess red cells or iron load, and that blood is discarded. So if you go to a blood bank with the intention of doing this, you'll want to be certain to check ahead. We'll have more about this in a later video. I hope this information was helpful for you today. If so, please like this video and do subscribe to my channel, Transgender Medicine Made Simple. Thanks for watching, and I'll see you in the next video.